Welcome back. So continuing our health lead, the fate of the J&J vaccine in the U.S. could be decided tomorrow. That's when an influential advisory group to the CDC will meet to discuss whether or not the pause in distributing the vaccine should end or continue. This, of course, is in response to the 6 cases of a severe and rare brain blood clot and whether there was a link to the vaccine. Joining us now to discuss, CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, what are the chances that the J&J vaccine will go back on the market tomorrow, but maybe with a warning that in extremely rare cases, the blood clot can happen?
I think that seems like the most likely scenario. You know, we'll see. One thing to keep in mind is part of the advantage of having this time over the last week or so is they were seeing if were there a lot more patients that were sort of going to declare themselves and say, hey, look, that happened to me as well. In other words, was this a needle in a haystack or the tip of an iceberg? We're not hearing about a lot more cases. So we thought it was rare. It continues to be rare. So in certain cases where people may already have a pre-existing condition, concern about blood clots, this may serve as a warning to them. That's what they did in Europe, by the way. Not that the FDA always matches what the European Medicine Agency does, but that seems like the most likely outcome here, some kind of warning.
The White House announced new efforts to try to boost plateauing vaccination rates. They're offering incentives for businesses to allow their employees to take time off from work to get vaccinated. Do you think the numbers are slowing because of a lack of ability to get the vaccine or because so many people remain skeptical?
Well, we've been doing a lot of reporting on this, and I do think at this point it's still a combination of both. There are still some places around the country that are just harder to reach. People have not been able to have the same access to the vaccines, even though they become much more accessible in so many other places. And then you're seeing the impact overall of the vaccine hesitancy or the lack of vaccine confidence. Show this graph if we have it. This is some polling that came out of the Kaiser Family Foundation. But basically right now in the country, about 61% says either they have had the vaccine, they're going to get it, they have no problem with it. The bottom green lines are people who say, only if needed or definitely not. But it's that blue line in the middle, Jake. It started off at a high level. It's down to 17% now. That's the fence sitters, the movable middle. People who, they could flip. And the numbers have been coming down in terms of people who are hesitant on that blue line. That's, I think, where a lot of the focus is going to be. A lot of them just want to wait and see, let other people go first, and then they'll go. If they flip, and a significant percentage flips, that gets us closer and closer to this herd or community immunity.
Yesterday, I had senior COVID advisor to the White House, Andy Slavitt, on the show, and he told me the CDC is putting together new guidance for vaccinated Americans like you and me. What's this, how come I still have to wear a mask outdoors, for example? That's a question I asked. What does the science say about what the rules should be for people like us who are vaccinated?
Well, let me share with you some of the numbers first overall. And we have data now around this, like how much of the people who are becoming infected are getting infected outdoors. Small percentage, less than 10% of these cases are happening outdoors. That's just across the board. But 18.7 times, that's a number I shared with you earlier last year, Jake. That's the odds of transmission indoors versus outdoors. It's almost 19 times more likely to happen indoors versus outdoors. So keep those in the back of your mind. As a general rule, Lindsay Marr, who's somebody who writes a lot about this, she says if you've been vaccinated and you are not vulnerable, high risk, you really don't probably need a mask outdoors. But there is some common sense that comes into play here as well. If you're in a very crowded outdoor setting where you're going to be stationary for a long period of time and there's high viral transmission in your community, that's something you can check, then that's going to be more of a risk. It's more of a risk that you're going to breathe in someone else's air and that air may contain the virus. That's basically it. So outdoors in general, vaccinated, not vulnerable, probably don't worry about it. But if you're in a high-risk area and you are considered high risk yourself, then I think, a mask is still going to be a good idea.
If you were to go, you and I are both fans of Dave Matthews. If you were to go to the Dave Matthews concert, he just announced he's touring outdoor events this summer. Would you be willing to go? Would you wear a mask? How would you handle that?
Yeah, I think so. I think that it'd be curious to see. I just heard about that from you, that they're going to have these live concerts. Where are we in the country at that point? I think in the summer, what I've been optimistic about for some time is that the rate of transmission at that time may end up being so low that the likelihood of me coming in contact with someone who's actually carrying the virus is going to be pretty minuscule. And at that point, I'd be very comfortable going. If for whatever reason, one of these concerts, and he's having several of them in several cities, one of these cities has a high rate of viral transfer, so viral transmission, then I would be more worried. But low viral transmission outdoors, I'm not vulnerable, I'm vaccinated, I think I'd be good to go.
Okay.
And I'd like to go.
Yeah, I know you would. Okay. Me too. Dr. Sanjay Gupta, thanks so much.